Okay, now let's look at subcortical disorders. Like we mentioned earlier, we have Alexander disease and we have Canavan's disease. Now both of them will have macrocephaly. It'll be a big head. I'm sorry. Yeah, there'll be increase in the head size, and both of them will involve patients less than 1 year old. So what's the difference? Alexander usually involves the frontal white matter. Now I usually remember it as Alexander the Great. He was a leader. He was always in the front. So frontal white matter. And Canavan, it involves diffuse bilateral subcortical U fibers. Now we talked about the U fibers. U fibers are just beneath the cortical mantle. You have involvement of these white matter areas. This is the gray matter and this is the white matter. So you have involvement of these U fibers. Now this was not seen in metachromatic leukodystrophy, but this is seen in Canavan disease. In Alexander disease, besides involvement of the frontal white matters, you have enlargement of the caudate heads. And there is enhancement of the white matter involvement on T1 post contrast sequences. Significant enhancement. Over here, besides involvement of the U matter, you have elevated NAA, which is very diagnostic. The way I remember is that Canavan, I usually spell this as Canavan, and there is elevated NAA. So that's a sort of a learning trick, but everyone has their own tricks, so feel free to use whatever you're comfortable with. And there will be no cystic lesions in Canavans. This is sort of a very specific sign. If you have cysts, it's not Canavans, and there will never be any enhancement. So let's see a case of Alexander disease. Alexander, over here you have frontal white matter involvement, plus you have hyperintensities in the caudate nucleus, which appear to be very enlarged. And here you have Canavan. There is diffuse involvement of the white matter involving the subcortical U fibers as well. Now, in comparison to metachromatic leukodystrophy, this was deep white matter involvement. The subcortical white matter was not involved, like you can see over here. There are no hyperintensities in the U fibers. But over here in Canavan, it's completely different from MLD. You have the U fiber involvement, so that's how you can differentiate it. And let's say MRS, if you do the spectroscopy analysis, you will see a very big NAA peak. So that's a dead giveaway. Now there are other leukodystrophic disorders which are not as important, but for the sake of completeness of the broad picture, we'll consider these. One is Krabbes disorders. Krabbe is also known as globoid cell leukodystrophy. Now this is the imaging appearance is that there will be a halo around the dentate nucleus. So this is your cerebellum and this is your dentate nucleus over here. So there will be a diffuse halo around it that helps you distinguish this from other diseases. And also there will be biothalamic involvement on non-enhanced CT. There will be thalamic enlargement. There will be big thalami. Now let me just show you a picture. Now I just did a quick Google search, and here you can see that the thalami are hyperdense on non-enhanced CT, and then you have dentate nucleus halo. Now I did a quick Google search about for the images, and you can see that there are hyperdensities in the thalamic nucleus bilaterally, and also there will be a couple of pictures on the halo around the dentate nucleus. In the first image over here, you can clearly see that there are hyperintensities involving the dentate nucleus in the cerebellum. Another disorder to consider is Plaisius-Merzbacher syndrome. I'm not sure if I'm pronouncing it right. It's Plaisius-Merzbacher syndrome. And this is a very close differential of metachromatic leukodystrophy. It is not the exact same disease, but it's very similar to it. The couple of differences is that it involves younger age groups than MLD. It will involve neonates, less than 1 year old, and even sometimes less than 1 month old. Neonates supposed to be less than 1 month old. Now, another disease to consider is Plaisius-Merzbacher syndrome. I'm not sure if I'm pronouncing it right. Now, this is very similar to MLD, and it involves neonates and children less than 1 year old. And one of the characteristic finding is that there is atrophy of the cerebellum. That's how you can differentiate it from MLD. This atrophy of the cerebellum is not always present, and so there is a very big overlap in MLD and Plaisius-Merzbacher. They always are one of the two differential diagnoses which go hand in hand. But it's very important to differentiate between them. This disorder can also show tigeroid appearance, although not as severe as MLD. So the differentiating point would be to look for atrophy of the cerebellum and the brainstem. Now, another disorder that we spoke about earlier during the classification was Vander Knapp disease. The Vander Knapp disease is also known as megaloencephalic leukoencephalopathy. It's an autosomal recessive disease, and there is basically swelling of the brain. Oh my God, I have terrible handwriting. And there will be small subcortical cysts. And it usually involves the temporal lobe and then the frontoparietal lobes. So basically it spreads in this fashion. There will be temporal lobe involvement, then frontal and then parietal lobe. And the basal ganglia would be spared. So that's a big differentiating point. And as you can see, there will be cyst involvement, and therefore the head size is enlarged due to the swelling of the brain and cysts. There's enlargement of the head size, and slowly, the symptoms begin at later date than other leukodystrophies. It's a slowly progressive disease, and the cysts, they expand the gyri. So that's why you have the swelling of the brain. And there is normal corpus callosum and the internal capsule. So basal ganglia is spared along with the normal corpus callosum and internal capsule. So that's how you differentiate it. One other disease, lastly, we'll talk about is the vanishing white matter disease, which is very similar to MLD, but you have early cyst formation, very early in the disease onset, and it basically occurs in 2 to 5 year olds. And if you have this disease occurring in 2 to 8 month old children, then there's a subtype, which is the Krabbes subtype, CREE, and that is the severe type. And the CSF analysis, you have increased glycine, and basically it looks a lot like MLD, and there's a syndrome associated with it, which is the CACH syndrome, which is childhood ataxia CNS hypomyelination syndrome. It's basically hypomyelination of the white fibers, and along with that cerebellar involvement and ataxia in children. Let me just show you a picture. Now this image is consolidating everything that we talked about. We'll start with MLD. MLD over here has white matter involvement, deep white matter involvement with no subcortical U fibers involvement, and there's sparing of the U fibers, and there is subtle hypo-intensities within the white matter, giving it a tigroid appearance, a tigroid appearance. With after MLD, we talked about X-linked adrenoleukodystrophy. Adrenoleukodystrophy involves the splenium of the corpus callosum and the occipital white matter. There are three zones, like we talked about: demyelination, an inflammatory zone, and a burned out zone. And the second zone, inflammatory zone, is the one which is enhancing. Then we talked about Alexander disease. Alexander is like Alexander the Great, always ahead of everyone and always ahead in the brain also. It involves the frontal white matters. And then we have Canavan. Canavan, there is diffuse white matter of the white matter involvement involving the subcortical U fibers. Then we talked about Plaisius-Merzbacher disease, which is very similar to MLD. It also has a tigroid appearance, but however, in this section you can't see it. What you can see is that there is atrophy, and if you were shown the cerebellum, you would see that there is atrophy of the cerebellum and possibly the brainstem also. In Krabbes disease, you have bithalamic involvement. There will be hyperdense thalami on non-contrast CT, and also you have halo around the dentate nucleus. And then we have vanishing white matter disease. Vanishing white matter disease has severe atrophy of the white matter, and you can basically see that it is following the CSF signal intensity, sorry. And this is the flare image, and you can see that it's dropping out on signal, and there's severe atrophy along with the broadening of the gyri. And lastly, we have the megaloencephalic leukoencephalopathy, which is also known as the Vander Knapp disease. Now, I just did a quick Google search, and you have these small cysts, which you can see in the bilateral temporal lobes, over here in the high frontal lobe and the temporal lobes. You have cystic formations. So early on, you can differentiate this from other types of diseases, because early in the disease you have cystic lesions, and these cystic lesions, they cause ballooning of the gyri, and due to this there is swelling of the brain and there is macrocephaly in the child. So I hope this gives you a broad overview and a big picture of the leukodystrophic disorders. If you want me to go into details of these, I would be happy to make a 10-minute lecture on a single disease. Please let me know whatever you think in the comments below, and if you like it, please subscribe and share. Thank you.